A major announcement today from the World Health Organization. The WHO declares Mpox, an Mpox outbreak on the continent of Africa, a global health emergency.
The international agency said a deadlier strain of the virus has reached unaffected provinces on the continent of Africa. And the WHO said this recent outbreak is of international concern, which is leading to fear here at home.
Yeah, we're committed to the facts, not fear. Joining us right now is Dr. Brandy Darby, Director of the Division of Surveillance and Investigation at the Virginia Department of Health. Dr. Darby, thanks for joining us so much. Good to see you.
Thanks. Happy to be here.
All right, first, let's lay this all out here. What exactly is Mpox?
Sure. Mpox is a contagious rash illness. It's caused by a virus that's known as the monkeypox virus, and it's easily transmitted between people, person to person, who've been in close contact with one another.
Now, I'm curious here because this is the second time that we've seen the World Health Organization designate Mpox as a global emergency. So is there a vaccine? And if so, how effective is it?
Sure. We saw Mpox emerge in the United States in the summer of 2022. There was a very large uptick in cases, and soon after that, there was a very safe and effective vaccine called Jynneos that was rolled out that really helped us control transmission of the virus here in the United States. Unfortunately, in Africa, they haven't had the same level of access to this vaccine as we've had here, and we've seen continued increases in cases in Africa.
At one point, they were administering vaccines here. I know myself, I actually got an Mpox vaccine during that time as well. Who's most at risk for contracting Mpox?
Sure. While anyone can get the virus, about 95% of the cases that we've seen here in Virginia have been in adult men. Many of those men have reported having sexual interactions with other men. We've also seen people with HIV infections be overrepresented amongst our Mpox cases, as well as minority populations, including those of African American and Hispanic or Latino origins.
So if we think about safety and trying to get ahead of this a bit, how do we decrease our risk of exposure?
There's a number of really effective ways people can protect themselves against this virus. It really takes pretty close contact with an infected person for transmission to occur. So anyone who might be at greater risk, a lot of the types of transmission that we're seeing come through sexual contacts. And so for people who are very active, things that you can do to help protect yourself in addition to getting vaccinated would be things like not engaging in close contact with people who are known to have Mpox, making sure to wash hands and not share utensils after you've been around someone who's been infected. And then, other things that you can do to decrease your risk would be things like decreasing the number of sexual partners that you have and making sure to engage in safe sexual practices.
So we had touched on, facts, not fear. And so we just wanted to touch on, something that our audience might be wondering. Should we be worried or afraid of this?
Sure. Here in the United States, we have seen continued transmission of this virus, but at much lower levels than we saw in 2022. So, for example, this year, 2024, we've had fewer than 25 cases of Mpox reported in Virginia, compared to over 600 cases, in 2022 and 2023. So what that tells us is the risk is much lower than it used to be, but it's still here. And so it's important for people to continue to take steps to protect themselves from this virus. Obviously, we live in a global community, people travel, so there's definitely a chance that with the situation in Africa, we could see new importations of this virus. And so there's a continued risk, and we just want to encourage everyone to take steps to keep themselves safe.
All right, some good advice there and a great note for us to end on. Dr. Darby, thank you so much. Also, want to thank Logan as well for helping us coordinate this interview so quickly. We appreciate you both. Thank you.
Thank you.